Good afternoon, everybody. We're going to go ahead and get started with our luncheon speaker. I know it's just a couple of minutes early, but I anticipate people will have questions for her. Alicia Clark was going to be here from the Department of Mental Health and Addiction Services. However, she ended up with a conflict and was unable to join today. So in her stead, Ellen Augsburger's here. And Ellen is the project director of the state opioid response for the state of Ohio. That is one of the large gluts of federal funds that have come in to assist communities nationally with opioid-related interventions in the last couple of years. And so Ellen has been with the State Department of Mental Health and Addiction Services for about 5 years. She leads a team of 10 individuals who help communities with implementation issues related to the use of these federal dollars. They track and monitor and provide accountability readouts back to the federal government as well as to members of the General Assembly and interested parties. They've actually got a really good website where you can go and click on a county and see what's going on. But given the fact that this symposium is focused on interventions in Southeast Ohio, we thought that it might be of interest to you to understand how the recent federal dollars for opioid response are being programmed in this region of the state. And so that's what Ellen is going to share today. So please join me in welcoming Ellen to the stage.
Thank you so much. So I'm Ellen Augspurger. I'm the project director on the state opioid response grant. I was also, and guess I'm still, the project director on the Cures STR grant, which is the federal funding that preceded this one. I want to start today. We're going to start big, and we're going to talk broadly about the grant and the goals. We'll talk about some statewide programs that are available to you, and then we'll kind of break down and start looking at hospital regions, and then get a little more granular and talk about specifically what's being funded in this region. So first up, just keep in mind that our goal is really to provide treatment recovery supports to about 9,000 people a year. So across the state, we're hoping to do that level of work on the ground. We have some big ticket goals, right? We want to provide naloxone. We know that's critical. We want to keep an eye on workforce development and training, making sure that people have access to what they need in order to be successful. We're also engaged in some of this targeted media awareness. You may have seen Take Charge Ohio or Denial Ohio types of media campaigns. We're really heavily invested in those and making sure that the word is out about medication disposal. We're also looking at MAT expansion, so training our medical providers. We've had several successful trainings down in Athens, so we'll be looking to continue those. And then peer recovery support and recovery housing, which I know you guys are learning about a little bit more today. So we'll jump right in. So our target population, we're looking at adults and adolescents, so these are not age-restricted funds, which is a real blessing. So we're able to work with folks both above and below the ages of 18 who may be impacted by opiate use disorder. And this was really driven by the fact that we have about 221,000 Ohioans with an unmet need for treatment. So we're looking to make sure that we have access to care for all of these folks. We did do a little bit of research before we kind of jumped into the funding. We did something called a targeted response initiative. And we were actually in Athens County doing a little piece of that at one point. We interviewed individuals from families, from providers, from persons with lived experience of opiate use to try and understand what was available in the communities and what was lacking. So we took those ideas and we met with stakeholders such as yourselves, providers, associations, and we took the outcomes from the TRI interviews, and then we took the ideas and the needs reported to us by our stakeholders and our providers, and we put them together to come up with some of these large statewide initiatives that wrap around your local programming. All right, so prevention activities. So we have the media campaigns. Has anyone seen Take Charge Ohio? Has anyone been to the website yet? Yes. All right, if you haven't been, you gotta go. You gotta see it, it's pretty cool. We have the ability from there to do prevention messaging as well as linking people to treatment access, right? Which is such a critical piece and component. It has elements of how to talk to your family, how to talk to your neighbors about the opiate epidemic, some really strong prevention campaign information for you there. Naloxone distribution. So initially we had about $750,000 that were set aside to purchase naloxone and distribute it, particularly for first responders. This initiative, we partnered up with the Ohio Department of Health, and we were able to bring $4 million of federal funding to the table. We were able to expand access to naloxone by sponsoring, I think it's 38 new naloxone distribution programs across the state. We are looking to continue those as we move into the second year of the grant with the potential for expansion. So we're really excited to be able to get this life-saving medication out and onto the ground. We also have drug destruction bags. So drug destruction bags are bags that you put unused medication into, you shake it up, and it becomes chemically inert and safe for disposal. This is critical for parents, for grandparents, for the general public to have access to when you have medications that might potentially be dangerous for the children in your home or for other individuals that are visiting you. We run this through Interact for Health, so if you are interested in these bags, I'm doing a little sales pitch. So if you're interested in getting these bags for residents in recovery housing, for families, for PTAs, you can look for Interact for Health. They're a nonprofit out of Cincinnati. Google them up, and they have a list where you can sign up to receive these bags. All right, so we're going to talk a little bit about regional catchment area projects. Is everybody in here familiar with your ADAMS board? Is everybody MHSRB boards? Yeah? Okay. So we kind of split those up at the department into hospital catchment areas for this grant. And we asked them to apply together for funding. So rather than just, say, Athens, Hocking, Vinton County sitting down and looking at their individual needs, they got together with everyone in their region to look at what was needed across the entire catchment area. This brought a little bit more coordination because we know that our patients don't stay just here in Athens. They may show up also in Portsmouth. We might see them in Chillicothe. With our patients being mobile, our treatment system and our recovery supports have to be flexible and planned, right, to meet them wherever it is that they show up. So we coordinated this kind of across the regional systems, and then everybody got together and talked at the state level as well to make sure that everybody was in communication about what services they really needed and how they could support each other. So Summit, which is a little bit north of us, they were really focused on access for persons who are in incarceration and looking at perinatal programming. You'll notice that those are two big themes as we talk broadly about these types of catchment areas. We also have a lot of peer recovery support services and recovery housing initiatives in the Summit County area. With the Northwest region, which is kind of across the state from us diagonally, they really wanted to engage in rapid access. So they partnered with the University of Toledo, and they created pathways for individuals to come from any of these counties to the University of Toledo Emergency Department and receive immediate access to medication-assisted treatment, placement within a crisis setting, and ongoing treatment and recovery support services. For the North Coast region, they're another large criminal justice investment area, so they really worked together to create different types of programs that would smooth pathways for persons who were in a jail setting or another setting of incarceration, as well as emergency departments. We know that our emergency departments see a lot of patients in crisis related to opiate use disorder, and so the North Coast created some programming that would allow them to go streamlined right through from the ED and into treatment. Heartland, which is another one above us here, we've got MAT and Behavioral Health Services in jail. They've got a 24-hour on-call treatment navigator service. So sometimes you just don't know who to call, and they're able to have someone answer the phone and say, who do you need? What do you need? How can we help you? And they know the local treatment systems, and they're able to guide people directly where they need to go. The other piece that they were really looking at was the families. So if you have a young person who's in an out-of-home placement, how do we support the family reunification process? How do we support grandparents? How do we support those that may not know what resources are available for either a child who might have an opiate use disorder or one who has experienced some of the side effects of a parent having an opiate use disorder? Twin Valley is kind of right in the center of the states, Franklin County. They are also engaged very heavily in addiction stabilization, so they're looking at things like how do we ensure that we have peer recovery supports available to people in crisis? How do we draw people in from emergency departments? And then once they're released from the emergency department, what supports are available to them in an ongoing way? So engaging peers in the longer term to kind of stay with people and track people, and to be part of that opiate response team or quick response team that responds to overdoses and stays with patients over the long term. And here's Appalachian regional projects. These are probably very familiar to some of you. So this kind of region really was looking at naloxone distribution, smart recovery, rapid access, and outpatient services. I just want to take a couple of minutes and dive into a few of the local programs and some of the recent initiatives that you guys have had here. So over in Jefferson County, which is kind of the far corner of this particular catchment region, there's an integration now where medication-assisted treatment is available to folks that are in the CBCF or the incarceration setting in Jefferson County. This has been a work of several years to do education for jail staff, right? So we have to get the medical providers on board within the jail setting. We have to get all of the folks that work within. And then we have to really work with probation, right? So that when folks are coming out, they continue to have a support for taking that medication-assisted treatment. That program continues to grow, and they also have added a community case manager who's there to help support people, whether they go through the incarceration setting or not, in navigating the resources, whether that's recovery housing, peer support, or treatment. With Muskingum, they really invested heavily into a rapid access program. So this is really cool. They wanted to go out and figure out, because they have a big 5, 6 counties, right? Huge area to cover. So how do you do rapid access in a setting that large? And so they really had to partner up with health departments, with law enforcement, right? They had to get out into the communities to help them identify patients who need that rapid access to treatment and rapid access to care. So they really came together and brought a lot of different partners across counties and across cities. And those of you that try to do this type of coordination, you're probably going, what? Yeah, so they were able to get people to really work together and talk to each other and communicate about patients who needed that access to care. The other big piece that they did was something called the Maternal Health Case Managers Program. And this grew out of the Cures funding a couple of years ago. So they partnered with public health, and they took 2 public health nurses and turned them loose on the community to find women who were either pregnant or had the potential to become pregnant, who were also using opiates. And this was a real struggle. These women did not necessarily want to be found. They were afraid of judgment, right? They were afraid of stigma. They were afraid that they were going to get into trouble if someone found out that they were pregnant while misusing opiates. And so this maternal health case management program went into libraries, and they put up signs, and they did education for librarians. They went to food pantries. They went to churches. They were out in the community doing education for OBGYNs, for hospitals, doing everything that needed to be done in order to ensure that these women would have a safe space that they could come and say, I need help, and that they would be able to receive it. And they also provide care coordination and transportation if these women's babies are taken to Nationwide Children's, which is about an hour, hour and a half drive from a lot of these women's homes. And so right after birth, sometimes these women aren't able to coordinate transportation. And these maternal health case managers make it possible for mothers to see their babies in an ongoing way after birth. It's an incredible project. Give them a call, check it out. They'll take you on a whole tour. It's amazing. In Fairfield County, which is a little bit north, they're working on a quick response team and in alignment with peer recovery support. Fairfield County actually has 2 different federal opiate grants. So right now we have a lot of federal opiate money here in the state of Ohio. And they work to coordinate those different streams of funding to make sure that they have support for law enforcement and first responders to be able to go out and participate in quick response alongside a peer recovery supporter who's a vital piece of that team, to ensure that people know that they have a safe number to call, that they have someone that they can reach out to if they're ready to engage in treatment after an overdose. For Gallia Jackson Meigs, they also expanded their MAT Rapid Access Program. Are you noticing a theme, right? That was the big response was, hey, we need to be able to get people into treatment and we need to be able to do it fast. How do we do that? Peer recovery supporters, right, was one of the big responses, making sure that we have on-call treatment navigation. And they went out and they did a lot of outreach to people who are still in active use. So they were participating in communities and settings where they would encounter people who are still wrestling with their addiction and doing outreach and engagement there. And they've had a lot of success just showing up week after week and saying, hey, we're still here. We still care about you. Whenever you're ready, we're here to take you to treatment. Do you need food? What do you need? How can we help? And so that's been a really interesting way to reach out and get into that community and let them know that the door is open. Adams, Lawrence, and Scioto. Do we have anybody from that? That's pretty far south from here. Adams, Lawrence, and Scioto. Hey! So Adams, Lawrence, and Scioto, they're doing something at the Hughes Reentry Center, which is another criminal justice piece. This one's really fascinating. They're doing vocational education for people who are in recovery within that setting. So they're training plumbers and bargemen, right? They're helping them create good career skills and long-term jobs. So we've seen a couple of classes really graduate from that and go on to find employment, and that's helped set their feet kind of on that path towards early recovery and then long-term recovery. Here in Athens, Hocking, Vinton, well, we have a ton of programs. I'm sure you guys could probably stand up and tell us. I saw a lot of Hopewell folks, so I'm sure they could let us know what they're up to. We recently had SAMHSA, so they're the primary funder to us of these dollars, requested to come to Ohio, and they wanted to see a community that had done an excellent job of blending together treatment and recovery supports, housing, peers, IOP, resources for pregnant women. They wanted to see a community that had responded to this crisis by coming together tightly. So we reached out to Athens, the 317 board, right? Athens Hocking Vinton board, because we know that Athens has spent a long time binding together, right? A lot of communication and a lot of work has gone into making these programs successful here. So we have expanded a lot of MAT access down here. We've been sure to get people into evidence-based treatment. We have our amazing peer recovery supporters who actually spent lunch with us on that day to make sure that we had the perspective of the peers and the people who are in recovery to make sure that SAMHSA knows that these dollars are impacting them in addition to the other folks. We also have the HRS Moms Project. So the Moms Project provides wraparound services for pregnant women up to, I think it's 18 months after birth. So what they do is they provide everything that that woman could need, from childcare, right, to diaper bags, medical, pediatrician, parenting classes, and they're usually operated by OTPs, but in some cases they're not. You guys actually have a couple of these through HRS throughout this region. So if you encounter women who are pregnant who are in need of services for opiate use disorder, I'd encourage you to look for a Moms Project. Reach out to HRS, reach out to any of your OTPs. These programs are there to really come alongside the women. They've got peer mentors, women who know exactly what's going to happen and how it's going to go. They've got access to information about the child welfare system and what that's going to look like, housing, diaper bags, I mean, all kinds of incredible resources that the communities have come together to help provide for these most vulnerable folks in our population. So that's what's really happening kind of right here at a very local level. And none of these programs were things that, we at the state sort of sat down and went, I think that, Appalachian region needs these things. These were built by you. These were built by the providers. These were built by the boards, the voices and the advocates, right, of people who need the services. This is what drives the design of these programs. So I encourage you to keep speaking up, right? Keep talking about what your patients need, because that is what drives the design of these programs. So I'm going to pull back a little bit and look at some of the more statewide things that are available to help support the local initiatives. So we looked at a recovery supports expansion. Very passionately wanted to support more peer recovery support projects. Those are a rapidly expanding and an incredibly critical part of these. So we set aside for 33 additional projects. That's in addition to these local regional projects. 33 additional programs that operate for peers within jails, within recovery housing, within treatment settings, all across the spectrum. We make sure that the peers are available. We also have recovery housing. So we lack sometimes in the state recovery housing options for women who have children. And so we wanted to make sure that we emphasize specifically certain funds set aside to develop those types of options. That has been remarkably successful. We see a lot of women who are able to work through their cases in terms of family reunification because they're able to say, I have a house and I can have my child and it is safe and it is everything that you could want in a home for a child. So we're really excited to continue to see those programs continue to be supported as we move into the next year of the grant. So there's another piece that we do where we really look at the workforce, right? Workforce development, alongside with our moms. So the moms is actually a model. So we provide training as well as funding to implement the model. We try to go out and recruit new people to participate. We have 11 sites that we were able to fund for this year. We're really excited to see them grow and build across the years we move into sustainability. As you can see, they're spread out across the state. So again, this was driven by interest at the local level. They applied for the funding, and we were able to support them as we moved forward. Some of them are more experienced, and they can provide advice. So if you see a name up here that you're kind of familiar with and you're interested in the project, reach out. They're used to it. They want to help support this. They want to grow this model to the best of their ability across the state. Oh, that's probably not going to show up real well. But you can see there's one in Athens, and there's one in Jackson down here, as well as one up in Franklin County. They're spread out across the state a little bit, but we're always looking for more. Ohio START. Has anyone heard of the Ohio START project? Yeah, we got a couple. Okay, so Ohio START is amazing because it provides very specific supports to families that are engaged in the child welfare, juvenile justice, family court systems. It's an evidence-based model that's actually homegrown here in Ohio. It started up in Cuyahoga, and it spread slowly but surely, the way they do, across the state. We were fortunate enough to receive an investment not only from the federal government, but also from our state legislature. So we have funding that is both state and federal, and we know we've got our local partners that are coming in with their own resources as well to make sure that this program is successful. So currently it is in 34 counties. We are hoping to expand that number by 33 in the next 12 months. It's ambitious, so we're gearing up for that. Typically, the counties serve a minimum of 12 families at a time. Some of them serve a lot more. Franklin County will have more naturally just because of the population size. A key element of this program, though, is our family peer mentors. They have lived experience of both opiate use disorder as well as the child welfare system. And so they're able to really come alongside these families and these women and say, I know where you're at. I know what this looks like. And I'm here to be a support to you as we move through this process together. It also requires some partnerships. So we have our behavioral health providers, the juvenile and family courts, and then our PCSAs, right? Our children's services organizations at the local level. So it's also very trauma-informed care focused. So everybody that comes through the program, they're trained in trauma-informed care if they're providing services, and they are receiving trauma-informed care if they are part of this project. We're also working with our local partners to develop housing. So we have different groups. So we have Original Family Peer Mentors here in Athens. They're one of the big focal points in this program is the Family Peer Mentors. In Clinton County, they continue to have, what's really interesting there is they continue to have grandparents engaged as well through kinship navigation to help support them as they go through that family reunification process for their children and their grandchildren. And then Highland County, they've been a kind of a newer partner over the past year and a half. And they continue to provide communication, support, and they're adding more staff they're hoping to add more staff over the next 6 months to continue to provide that support. So those are kind of the big picture. I don't know how to go back to the beginning, so I'm going to leave it blank for the moment. But those are some of the big picture items. And I think I left time for questions about what we're doing locally or concerns, thoughts, anything that you might want to know about what we're doing on that broad basis or where we might be going in the future. So is anyone brave enough to go first with a question? Man, I managed to cover everything? I don't believe you. Yes. Yeah. So the question was about statewide, are programs doing anything related to NAS or attachment, working with children and infants who have experienced NAS. And so we don't specifically fund any studies or research related to NAS, but I do know that we have partnered up programmatically with Nationwide Children's Hospital. They've been a primary driver of kind of the early intervention around NAS. They've also been working with children and youth as they grow up. I don't know that they're focused on specifically attachment, but I know that they're looking at longer term outcomes for these children. So those would be kind of my first point of resource would be Nationwide Children's for you. Yeah. So the question was about how do nonprofits find funding to hire and long-term support a peer recovery support specialist, and are there funds that we have available for that? So we do definitely support that funding at the local level. I would recommend, if you're interested in hiring peer supporters, that you talk with your local county Adams board. They'll be able to help you guide and navigate through a lot of the funding. It is Medicaid billable as a service in specific settings and with different types of certification. We do offer the certification. It's free to take the training if you are a peer recovery supporter. We have a website. I think I'm going to mess it up because they just changed it all. But if you search MHA Peer Support Certification Ohio, the website will come up. We have a nice new website. I just don't know the addresses anymore. And that will help you also figure that out. Keeping in mind kind of that you want to make sure you've got adequate supervision as well. So that's always something to keep, if you're budgeting or asking for funding, keep that in mind kind of in the back of your head. Is you don't just need the peer support salary, you also want to make sure that they're supported and well supervised. Yeah.
I'm just kind of curious. In my personal life, I have a brother who is a recovering heroin addict, and he spent a lot of time in jail and that sort of thing. And then plus with recent developments in Gallia County, what kind of, what are you doing in the jail system?
So in the jail system, there are a couple of different initiatives that are happening. So we're moving forward with a telehealth in the jail program. Sometimes medical care is not adequate or accessible for folks that are coming through. So we're piloting access to behavioral health treatment as well as the medications that are necessary for folks that are in the jail settings. We're going to see if that pilot works out. We're also providing a lot more push towards peer inReach, as well as providing the assessments while you're still within the jail setting. We know that when folks come out, relapse is a serious potential, so working to provide the naloxone. So some of those Project Dons with the naloxone distribution, they're working within jails to make sure that when people leave, they have the kit, they know the signs of an overdose, they know how to prevent an overdose should they suffer a relapse upon being released from the jail. We're also working on expanding and making sure that we're working with the community linkage program, which is more related to prison. But for folks that are leaving our prison system and are returning home and need access to housing, need access to treatment, we're continuing to work to support those programs. It's called the CTP program if you're in the acronym world of state government. But they work very hard through a managed care organization, and then now going forward we'll be working through your local county Adams boards to make sure that folks that are returning to the community have access to housing and treatment as they need it. So those are a couple of ways that we're working on it. But it is a challenge, I will say that. And congratulations to your brother. I should also mention we're working on criminal justice stigma. Stigma has been such a battle for many professions about persons with opiate use disorder or who are in recovery from it. So we offer a criminal justice symposium on opiate use disorder and MAT. And what we've seen with that is it's a day-long program, and when people come in, they take a pre-survey that kind of subtly measures stigma that they might have regarding persons who are suffering from opiate use disorder or who are in recovery. And then afterwards, they take it again. And we are seeing that is changing. I think some of it has been around just not understanding the nature of the brain and what happens there, and about the evidence base related to the treatment, the psychosocial treatments, the behavioral health world, just not really understanding the evidence base behind some of the treatment. And so we've seen some success with that. And we're going to continue to offer those. I think we're pushing for 20 this year across the state. Yes.
Can you talk a little bit about sustainability planning, recognizing that these resources are not going to last forever?
Sustainability planning is always fun. Thank you for asking me that tough question. So sustainability planning under these funds is interesting because we had the same conversations with providers a year ago about Cures dollars, and then these funds appeared. Sustainability, we're really looking, this is the last year of these dollars. So we're looking at how do we make sure that programs will still exist even when I am gone, when the programming is gone, when the funds are gone. So the things that we're looking at really heavily investing in is skill building for our workforce. The people are not going to leave just because the funds go away. We will still have an amazing workforce that is committed and passionate, and if we can invest in those skills and in making sure that people are effective at their work and they know how to avoid feeling burnt out, they know how to be successful and support their patients, we believe that that long term will build and continue some of these successful programs. When we think about sustainability planning from a funding perspective, we're talking with individuals about, hey, if we 100% supported this salary last year, what will that look like so that we don't hit a cliff come next September? We want you to be thinking about expanding your Medicaid billing. Do you need support and training related to how to build Medicaid? I know behavioral health redesign billing is a little bit different. And so does your agency need help to build some of these new codes and to make sure that you figured out how to support these programs? So we're looking at heavily investing in training and technical assistance for our agencies that are looking to sustain these programs over the long term. We have been able to identify, hire, and train some amazing staff at many local agencies. So we don't want to lose them. We want to make sure that we have figured out how to bill for them. And so we're working with our county boards and our direct funded providers to really say, okay, what are the next year's funding sources? We're also doing a lot of data collection. Over the years, we've seen that if we have data that says, hey, this program is effective, it serves a lot of people, you can take that data to county commissioners, you can take it to another branch of the federal government, to the state, to your executive boards if you have one, and say, hey, we need to maintain this program. Let's commit to finding, right, another funding source, another way to bill, another program that we can utilize these resources within. So we're kind of talking with everybody about the planning, making sure that we're not just going to hit that 100% cliff come next September, making sure that people have the skills that they need in order to be successful. And over the long term, that's our greatest resource, right? It's our people, their knowledge, their experience, and their abilities to continue this work and these programs. Did I get in the ballpark of answering your question? Okay. Any other thoughts? All right. Thank you so much.
Okay, we are exactly on schedule. Just a few announcements. If you're feeling like you might be a little lonely for family and friends right now, you don't know what's going on with the outside world, you've lost your cell phone. Michael has it over here, so if you've lost your cell phone, please see Ms. Searles. We have a 15-minute break, and our next two sessions begin at 1 o'clock sharp. The recovery housing session is going to be held in room 145, again, first floor, and the evidence-based prevention session is going to be held in room 245 upstairs. Please note that we need you to come back here for the next plenary that I think begins at 2:15, and we will have evaluations for the day available to you there. In order to receive continuing education credits, you will need to turn that in upon your departure at the end of the day, and we will take your name, and that's how we'll make sure that you get your continuing education. If you are not seeking continuing education credits, we still want you to fill out the evaluation because we want to know your feedback from the day. So please make sure that you do that. Those will be here at your place when we reconvene in this room after the breakouts. So with that, you have a brief break until our next session. Thanks for your attention.